Okay, this lecture is diseases associated with meat diet versus plant diet. And so, this is so obvious, it's ridiculous, all right? These are things associated with increased meat in the diet. Obesity, the higher the percentage of fat, the higher the incidence of obesity. Meat's got tons of fats. A good thing to remember for meat is salmon. 50% fat, 50% protein. There's no carbohydrate in meats and animal foods other than milk. So basically, you're going to have tons of fat and tons of protein as the standard for an animal food. So they make you fat, okay? Increased dietary fat plus meat often is either stored or salted. Hypertension. Increased dietary fat causes diabetes. This is the trifecta of disaster in modern health. Then, of course, diabetes and hypertension and obesity, they all are associated with increased atherosclerosis. Plugs up the arteries in your heart, coronary artery disease, myocardial infarction, arrhythmias, atrial fibrillation. Plugs up the arteries to the Johnson, impotence. Plugs up the arteries to the spine, beginning with degenerative disc disease. That progresses to DISH. Diffuse idiopathic skeletal hyperostosis, OPLL, ossification of posterior longitudinal ligament. I wrote an entire book on this. Ischemic spine is most common cause of back pain. Increases the risk of cancer, especially because of the animal protein and its amino acid composition, but also because the fat causing ischemia. And this is actually one thing that I think T. Colin Campbell under-recognizes. He's always emphasizing the growth hormone effect of animal protein. And of course, I think he's right about that. But the ischemic effect of fat leading to a Warburg-like mechanism of tissue hypoxia is also relevant to causing cancer, okay? And of course, not even just the ischemia and the animal protein growth hormone effect. There's the estrogenic effect. So I've talked about that in other lectures, but the point I'm making here is it's pretty obvious. Constipation. There's no fiber in meat, so you get constipation because you're straining at the stool, diverticulosis of the sigmoid colon diverticulum pops, you get diverticulitis, stool spills out into the adjacent mesenteric fat, becomes inflamed, you often get an abscess. I see people with this diagnosis every day, diverticulitis, because you've got dry stool on the right side of the colon instead of wet stool because fiber pulls water into the stool, you plug up the appendix. The obstruction of the appendix ostium where it connects with the cecum, part of the colon, causes the mucus glands below to keep secreting, and so it gets distended until it pops. Stool spills into the mesentery. That's a perforated appendicitis. Because they're constipated, they're straining at the stool, increased abdominal pressure syndrome, described first by Burkitt back in the 1960s. They get gastroesophageal reflux, and their upper stomach pops into the chest, hiatal hernia. Gastroesophageal reflux then causes a change in the lining cells of the distal esophagus. That's called Barrett's esophagus, and that predisposes to esophageal cancer. And that's the most common cause of esophageal cancer nowadays, that type of cancer, an adenocarcinoma. It used to be squamous cell carcinoma from smoking and drinking, smoker-drinker cancer. Now it's, fat person cancer. Okay, all the autoimmune diseases, because meat is associated with increased causing of leaky gut with subsequent molecular mimicry and autoantibodies and whatnot. And so that increases all these terrible autoimmune diseases, multiple sclerosis, lupus, rheumatoid arthritis. Increased leaky gut can also predispose to localized inflammation within the intestine itself, Crohn's disease, ulcerative colitis, and the milder form, IBS, irritable bowel syndrome. And of course, the atherosclerosis, the coronary artery disease, the atrial fibrillation increases the risk of stroke. And then just the baseline tissue ischemia. Most common cause of dementia is vascular dementia, by the way. And vascular, along with excitotoxicity, we talked about this in other lectures. This whole Alzheimer's thing is bogus. I've described that in some detail in other lectures. But the bottom line is this high dietary fat, animal protein based diet, the modern American diet, standard American diet, is major high risk for dementia. And so here's the diseases associated with eating plant foods, healthy plant foods. I'm not talking about processed food. I'm talking about whole plant foods. None. Okay? None. You don't have to be a rocket scientist to see, I can avoid all the common diseases that by far are the most common causes of suffering and death. That's as good a deal as you'll get in life on anything. So like I said, knowledge of this, it's a form of power. Every hospital in a westernized, industrialized country in the world is full of fat people who die prematurely because of diabetes, coronary artery disease. They're sad, the men, because of impotence. They try taking Viagra, don't always work for them once the artery's completely plugged up. and cancer. So you're winning the jackpot for health to know this, and it's not that complicated. It's easy to do.